One of the procedures we do as interventionalists is place stents and stent grafts. These are commonly placed either in the bile ducts, which are ducts that drain the liver, or can be placed within the vasculature like arteries and veins. This one in particular is partially covered, as you can tell, meaning that it doesn't have anything that's exposed to what's on the inside. You can't see through it. And then a portion of it which is partially uncovered on this end. These are used in the biliary system and the bile ducts. Occasionally people who have different kinds of illnesses such as that cause biliary ductal obstruction, such as pancreatic cancer, which can obstruct the bile ducts, will require a stent to be placed. Now there's multiple different ways and different kinds of stents that can be placed depending on where the obstruction is, but this is one of the more common types of stents that are placed by interventionalists. And this part will sit along the duct that drains the liver and the gallbladder, called the common duct, and will go into the small bowel. There are other kinds that are more vascular type stents, such as this. And again, they come in multiple different shapes and sizes for different kinds of vessels, some of which will be longer than others. One thing to note is some of them can be quite crush resistant in areas where you're going to expect them to flex a little bit more. Some of them are going to be less crush resistant, but that's the general idea of what a stent is. The way that they're delivered, usually they come in a system which allows them to be completely stretched out, and then when they're deployed, they take a certain form.